Once again, thank you for joining us. Today we will be going over the Community-Based Child Abuse Prevention Program, which is also known as CBCAP, and the Child Trust Fund Program, CTF. And I call this a Program 101 because it's just the basic information on where we should be guiding all of our efforts towards. Oh, I'm going too fast. Okay, this is our agenda for today. We will be going over the program's purpose, the target population, and the program, the authorized program activities. We will be also discussing about a summary that I mailed out to you guys this weekend, and we'll talk more about that and why I sent it and the help that I'm going to need from you guys. Okay, so Community-Based Child Abuse Prevention, CBCAP, and the Children's Trust Fund are both funding, program funding, that are based, that are focused on prevention. Prevention is the key word here. Prevention is considered anyone who is not enrolled in the system. So it's prevention, children, families, clients that are not in the child welfare foster care system. Okay, CBCAP is a federal grant. It's federal funding, and CTF is our state funding. The purpose of CBCAP is definitely, as you state here, I noted where you can find the regulations and the law. It's to address prevention in child abuse and neglect. And it's part of the CAPTA, which is the Child Abuse Prevention and Treatment Act, which a lot of our prevention funding kind of ties back to CAPTA, and even the activities and other funding that we award through our office also tie back to CAPTA. So CAPTA is pretty much like the mother of grants. The purpose of the CBCAP is, one, to support community-based efforts to develop, operate, and expand, enhance, and coordinate initiatives, programs, and activities to prevent child abuse and neglect, and to support the coordination and resources and activities to better strengthen our families. So please pay attention to the program purposes as you apply for funding in the coming year. And if you have an idea, or you have something that you want to improve or change or try something new which falls within prevention, please look at the purposes and present your ideas, and we are more than happy to, like I said, think outside the box, and I'm going to give you more resources on what other states are doing so that we can at least kind of all sit down and make sure that we do the best we can for our state. Also, one of the goals or the program purposes is to foster understanding, appreciation, and knowledge of diverse population in order to effectively prevent child abuse and neglect. And I think that this is important in every grant to make sure that we are culturally sensitive and open to diverse populations. CTF, like I mentioned, is a state funding, and the Children's Trust Fund is dedicated to the prevention of child abuse and neglect. And this is funding from, I believe, is death certificates. So every death certificate that some of the money is driven for this funding to prevent child abuse and neglect. So the state doesn't have any strict rules, but we do mention, let me mention to you that we use CTF as leverage or kind of matching funding for CBCAP. So they go hand in hand. When we talk about CTF, CBCAP, we're pretty much using the same guidelines because we are using that as match or leverage funding for the federal grant. CTF is, here it is. CTF is a special account that receives fees from Nevada's birth and death certificates to supplement the fund. The GMU submits an annual application for federal community-based child abuse prevention, CBCAP, grant funds established by Title II of the Child Abuse Prevention Act treatment. So like I said, we are required to put in some leverage as a state, and we use CBCAP, CTF funding, so state funding to support and try to obtain more funding from the feds. But again, same program, same guidelines, same expectations. CBCAP and CTF program description. You will read, I don't want to read everything because you can read, but it is really important that you know that it's not just one program that we're funding. It's not like, oh, if I apply for CBCAP or CTF, I have to provide this program. I have to do parenting. I have to do whatever other activities we identify here. It's to really make sure that we can adapt our services and our service delivery programs to our state. It's to make sure that every community has different needs. We have a vast rural community that doesn't have access to a lot of families. So it's whatever you think, whatever you know that your agency and your community needs in order to expand the prevention efforts. We want to hear them. We want to hear about them. This CBCAP and CTF do require evidence-based programs, but it doesn't mean that we can't, get out of evidence programs. We are moving towards that, but we do understand in the state's or CBCAP office on the federal level understands that Nevada is pretty unique when it comes to the rural areas, and we want to make this. We want to try to reach as many Nevadans as we can. Target population, home prevention, are parents, teen parents, parents and children with disability. That is a big one. Racial and ethnic minorities, members of underserved and underrepresented groups, fathers, homeless families, unaccompanied homeless youth, and adult former victims of child abuse and neglect or domestic violence. Again, this is the parents and children with disability. GMU has seen that we have not pushed that. We really need to get the numbers of parents with disability and children with disabilities that we're serving, because that's a population that we do not want to miss, especially with every grant, with any grant. Prevention programs and activities that are authorized, any comprehensive support for parents, anything that promotes the development of parenting skills. And I know that we have great programs out there that provide parenting classes. Any program or activities that improve family access to formal and informal resources. Any support for parents with disabilities through respite or other activities. Any referrals to early health and developmental services. Promote any program or activity that promotes meaningful parent leadership. And this is a big one that we will discuss. CBCAP is really pushing for every state to have a parent leadership group. So I'm gonna pick your brains and see if any of your agencies already have something similar to that, or if we wanna, what we can do to get that, the parent input, and not just with CBCAP, but the parental input in all programs. Parents that are already in the system that we're offering services to them. We want to hear what they have to say. We want to hear what we're missing. They're the ones living in that situation, and we are just reading guidelines and making decisions that may not really reflect their needs. In any programs that can also we can also finance the developmental and continuum of prevention services through public-private partnerships. So again, we are going to be opening an application pretty soon. I don't have the exact date, but you guys will get a notice, before we post it. And we want you guys to, because we will be the ones that will be looking at the applications and the and kind of guiding the process. So we kind of want to know, get out of the same programs. If they're working amazing, then we can keep them. But I just don't want you as agencies to feel like you're tied down to one program when it comes to prevention. All programs have to follow the protective factors. Somebody had a question? No? Okay, so all programs, authorized programs, have to fall within the 6 protective actions factors. Sorry. So I'm going to show you a website that is dedicated for CBCAP. and it has a ton of information. It has a ton of examples of what programs fall within the factors, protective factors, and I know that our programs that we are running now do fall within that. And we're going to go over the reporting requirements, which is a really important part of any grant, especially CBCAP. Like I mentioned, we inherited this program 2 years ago, and this year is the last year of the awards that the director's office issued. So the reports that we were receiving that were implemented by the director's office are definitely different from what we use, and all of you who have other grants know what I'm talking about. Our program reports are not perfect. Our program reports are not final ever, but our program reports do try to capture the necessary information for our reporting requirements. Our reporting requirements meaning GMU to the federal government in terms of the funding that we receive to allocate to nonprofits. So bear with us when we, as we go with the program reports, changes will be made. Please note anything that doesn't not work. Any feedback is always welcome. So we're going to go over the report that I created for CBCAP. It's really similar to Title 4B2, and it's really similar for what the Victim Service Unit uses for VOCA and FIPSA and NERCH license, I believe. Okay, so GERS, the GERS 2125 talks about the quarterly reports. We are all required to submit a quarterly report on the 15th, by the 15th of the following month reported. So, and you guys have been providing the previous reports that were implemented by the director's office. So I'm going to go with my report now. Oh, this is a duplication. Yeah, duplication, just in case you want to read it twice. Okay, my CBCAP demographic information. The template is just as the other ones I mentioned. Let me bring this over here. Okay, those who complete other reports for us are going to be familiarized with the template. It is a lot shorter, even though it has a lot of tabs. It is a lot shorter than any other program. And not all tabs will apply to you. We are hoping that our goal is that as we move forward with the programs and kind of adjusting what we have, all tabs will apply to you, except parenting program, if you choose not to do that. So, it's going to have your agency name, your grant number. It's going to indicate if you're a CBCAP or a CTF recipient, or some or both. We do have to indicate, and on the last application, it wasn't an application, it was more a continuation of application. We asked about the program activities that you were going to be offering. So that's going to be pre-filled by me using your application. And the cells are going to be locked. If you choose or you say, hey, and we're also doing this and it's not there, let me know. I will update the application and I will also update the report. We want to make sure that we report everything and every effort that you guys are making in the prevention field, just like we are doing in other reports. We want to make sure that we can prove that Nevada is working as hard as we can to prevent from any child maltreatment. Also, the target population was also on the application, and that is going to be also pre-filled by me. And I'm going to leave this open because as I reviewed some of the cases, some of the applications, some agencies said, oh yeah, we're doing parenting, but they were doing more than just parenting, and they were not, I just wanted to give you the opportunity to go back and make sure that your programs are accurately represented. So I will let you guys feel that. This is just as any other grant report. We want to know the new people, the people with disabilities, the children with disabilities, number of families, how many of the people that you are reporting are new, okay? This is just new clients, which I should highlight this in red. Someday, okay. So yeah, the new is keyword here because I am going to expect the ethnic and race, everything from here, this section, to be only reported on the new clients. This is no change to the other reports. First quarter, we will report everybody as new. And then moving forward on the other quarters, then we're only going to start entering the new clients, whoever came in on the second quarter and never been served by your agency. Okay. Parenting programs. This is important for me to explain. CBCAP is really pushing for any parenting classes or programs that are evidence-based. Okay, so I gave you the links that we are given to verify if your program is either supported, well supported, promising, emerging, or lacking support, positive evidence. We have no research on those. So I'm going to show you what we use, and you will have the link to check your programs if this thing works, of course. Okay, do one second. Okay, and we will go over the Friends website, and the Friends website is honestly our friend website. They manage all the training, all the information, anything new that's coming up, for all the states. So you will find any information regarding CBCAP or any prevention efforts, programs in this website. So we will go over it. I would like for all of you to have this handy when you have any questions. So this is where we check. Okay, so this is what they give us. So let's say that we are going to check. Where am I? Okay, right here. Oh, my report, sorry. I'm looking for my report. Okay, so let's say that we're gonna do this program. You're gonna take your program. You're gonna come here. You're gonna enter this program. I see. Let's take the 4th edition. Oh, maybe not. Okay, so yes, it tells you parenting, the parenting, active parenting, it's parent training, and it's supported. It's supported and the ages. Okay, so we use this to indicate to them that yes, this agency is providing this service, and this is where we rate their program, or their program is rated. So please feel free to use this link to check your programs. If you have any questions, please let me know. And I'm going to try to indicate this on your report. So this is going to be pre-filled by me, and I'm going to tell you where it falls within, this guidance. And if you have any questions or anything, you say, hey, Yara, that's not true, then we can research it a little farther, or we can even have Friends check it for us. Friends provide technical assistance to us. Friends are there to help the states do a better job or fix issues that they have found. And also, with that being said, they're here to help you guys, all sub-grantees, to try to get the information that you guys need. Collaboration and partnership is also important. All these tabs are important. The federal government is wanting us to report who we collaborate with, not just GMU collaborating with sub-grantees, which that needs to be strengthened. I would say there's not really collaboration. We need to we as in GMU, I need to work on making sure that we have constant communication, that we offer training opportunities, that we offer trends, statewide trends and national trends, so that you guys could have better tools to provide better services or improve your already good services. Okay, so, I'm asking that you please check any of the applicable sections. Does your agency collaborate with child welfare agencies? Do they, disability agencies, youth development, anything else? Do you work with a private funder or a private company? Do you work with U.S. Bank? And you guys, what is it that you do? Who are your partners in collaboration? And we have a list of partners that we need to collaborate with as GMU. And again, that's on the works. And the effort is to then bring you guys into the collaboration of the big picture. So if you could please help me out by providing me if you have any collaborations at this time that you work with in terms of prevention. Okay, so this is how your report is going to look. Any questions, please feel free to reach out. I created the report, so no, they're not perfect, but I should be the one that can answer those questions. And if I need to modify it, I am more than happy to modify it so that it fits what you guys are doing. Okay, I went over the report pretty quick. I know I talk fast. Program information, public awareness. And now this is in regards to the email that you received from me this weekend. GMU is required for CBCAP funding to provide an annual report for the previous fiscal year. So we did one last year, which was really hard to do because, again, I'm working with data and information that I inherited. So the feds know that this happened, and we're in a transition to actually be able to provide our own data, capture our own data, and something that I can defend on my own, saying this is what I meant when I collected this data. This is how I asked them to report this data. So it was really hard, but they are more than happy to work with us. So we have to report to the Child Bureau Office of Child Abuse and Neglect, an annual report. And then we also GMU has to submit an application right after the report. So it's just a different, we don't have those requirements on other grants. But for the annual report for the previous year, I did send a question sheet that I would really appreciate if you could help me out with that. And obviously, my goal is that we will not have to be collecting last minute data for the following annual reports. I apologize for this, but I really need your help. And these are some of the questions that I sent you, and this is regarding the previous fiscal year, so July 1st of 2019 to June 30th of 2020. I asked that you please explain how your agency has assessed the unmet needs in the state or in your community. Provide any inventory and description of services provided to families by your program that meets the identified community need. Include a description of numbers served. Providing evaluation data on the outcomes of program and activities funded under this program. For this question, what we are really looking for is your satisfaction surveys. How many, if you can send me a copy of your satisfaction survey and you send me the numbers of how many people responded to what. If you want to send me all your satisfaction surveys and you want me to calculate it, I can do that. If you have a table, an Excel sheet, a program, a system that collects the data, a report that you can print out would be good enough. That's what we're looking for that on the evaluation data. Provide evaluation data where appropriate and available on the effective of funded programs. If you have any reports from your program that you're using, any new data that, whatever, if you're using active parenting, do they have a new report? Does a company came up with something new that shows how this works, new information, we'll take that too. Include a description of Child Abuse Prevention Month and public awareness activities conducted during the reporting period. As a prevention program, participating in the Prevention Month and public awareness and making sure that we disseminate prevention activities or prevention trends or whatever it is that we can disseminate to the public in terms of prevention. We want that to be noted. We want you to report it. This is part of preventing child abuse and maltreatment. We have to put it out there. We have to make sure that we use every avenue to offer our services. And with that being said, I am going to be sending a link with a form that you can use and fill out for us to post any upcoming events, any programs that your agency is offering. And when I mean us post is DCFS. DCFS on our social media. We want to be able, we're partners, and we want to be able to say, hey, so-and-so happy agency is going to have a parenting class and starting this time. I mean, we want to be able to be your partners in promotion and put that on our own platforms. So please share any information you want us to post. We are more than happy. We have talked to IT. I've talked to the person that's responsible for our platforms, and she is going to make sure that as soon as we get a request, we're going to research it, and I'm going to send it to her. She's going to make sure that it gets posted on our platforms, social media platforms. And the last one is include a description of important contextual factors, challenge or barriers that impact the ability of your agency to implement the program planned for the reporting year. We know COVID definitely was something unexpected, and it continues to be unexpected. So give us, what the challenges were and how you resolved it. And, what do you still continue to see as a challenge? Because COVID continues to be in our lives, and maybe a lot of us had quick solutions. But if we're it seems like we're prolonging this and this might be happening for a while, what do you need in order to better service and better assist your agency so that we can provide better services for the public? Again, I appreciate if you could help me with this. I gave you the due date of December 29th. I understand holidays, anything. If you can't provide it on the 29th, shoot me an email. Please let me know when the most soon as possible that you could get me that documentation, those questions, please, and documentation attachments. Any questions for me? Let me minimize this. This is when you ask me questions and I say I will get back to you. Does anybody have any questions? What did I do? Okay, I have some. Yes. Brittany, did you say you wanted to be the presenter?
No, I was trying to navigate, so okay. Sorry about that.
Okay, because I would be more than happy to.
I absolutely do not want to be the presenter. I do not envy you at all, Yarsa.
Oh God, my heart is okay. So, but if you do, let me know, because I would love to give this to somebody. Okay, what if we don't run the program? Okay, this question is from a partner. Pecan, am I saying it right, Amanda? Pecan? So Pecan is the child abuse prevention agency that runs from UNLV, that has a lot of information and a lot of resources that provide good services. We have projects and ideas that we can collaborate more closely with them. So if you don't run the program and you get funding to do promotion, advertisement, trainings, then you will only report on those, on what you were awarded to do. Okay, so your data, your information, your questions should only be relating to the funding that you requested and you were awarded in your scope of work. Okay. Those are the only questions I have. I know I am really good at everything, but, oh no, there's more. Yeah, so Danielle has a really good question. She says, parent leadership in what realm? In the children's education, prevention of abuse, services to children with disability. I noticed that child self-protection training is no longer specifically listed. This is no longer a part of the programming. No, the new guidance is that prevention listed, okay, child self-protection training. I'm gonna have to check on that, Danielle, because my understanding is that anything that is prevention and not targeted to people who are currently in the system is what CBCAP should be awarded, used for, and CTF. So if child self-protection training is not targeted to children in the system, then let me research this and shoot it back to friends who are the ones that answer all my questions. And parent leadership in what realm? The federal government is asking all states to create or work or come up with a parent-child leadership group. So what they want is they want state and agencies that are making decisions on what works best for our community. We get the feedback from the parents, okay? And when I mean this is a big thing is CBCAP has an annual training in Washington and parents get to go. I mean, this is the parent input is always included. It must always be part of the decisions. For example, if we were to open the applications and we have a parenting leadership group, we would also sit, GMU would have to sit with them and say, okay, so as you know, this is coming up. This is what CTF is for. What do you think, you as a parent out there, what do you think, you know, what are we missing? You know, even review some of the applications so that they can have an input. I know that that is also kind of requested from parents that are in the system. You know, like we implement programs, we dictate what we want to happen, but maybe what I'm asking an agency to do is not what the recipient really needs. You know, I might be asking the agency to, okay, you got to go to our parenting classes. Well, that's great, but if I don't have food on the table, you know, we want to hear more from the parents. So I don't know if any of your agencies or your parenting classes or the services that you're providing already has a parent leadership club that we can build from or that we can expand on. I would really like to make sure that we address this requirement for this coming year for state fiscal 21. I don't, you know, it could be at the end. I know it takes time to get parents to participate, especially when you're talking DCFS and, you know, state. So if you guys have any ideas, if you guys have anything like that or anything that we can grow, please let me know. And definitely it's something that we want to see on your applications coming up, you know, the coming year, if you are interested or have something like that. Okay, it says we will be using this next reporting Excel sheet in the next quarter. The next quarter is January 1st. January, it will be the next quarter. So if you could please complete quarter 1 and quarter 2, I would really appreciate it. And that way I can capture 2 quarters at a time. And I was late on providing you the guidance. So if you can do that, I would really appreciate it. If you need extra time, please shoot me an email and let me know. Okay, I have another question. Oh, wait 1 second. Do you have an estimated time when we will receive the new update reporting Excel sheet? I know I'm really bad at that. Yes, you will have it. You will have it by tomorrow before 5 p.m. And I can say that with assurance because CBCAP and CTF are much smaller than other Title IV or other programs. So yes, this will be done. You will have it by the end of tomorrow. Tomorrow is the 23rd. Yes. Okay. It is prevention, not targeted in the system. It is prevention and not targeted in those in the system. Good. Perfect, Amanda. So I will. We can talk about that. Please shoot me an email so that we can look into it and make sure that if that's going to be an option to provide. Let me go back. protective training, child self-protective training, that we make that an option to everybody on the upcoming applications. Okay, Brittany, okay. Okay, let me go back and make sure I answered. What if we don't have a program? Okay, last fiscal year, Child Abuse Prevention Month was in April, right when COVID closure hit hard, and it would have prevented a good amount of events at this time. Okay, we know that unfortunately it was right in that time, and our prevention month may not look as good as other years, but we have that justification. But we're also looking at, you know, the reasons why, what we had planned, what fell through. So I need all the information you can give me. You know, if you had plans but didn't get to actually take place, then let me know what you had in plan and what you did and how did it, you know, if you were able to even do half of what you had planned or none. If you were using other means to make some of these events happen, you know, we want to know that. Okay, is a prevention, okay. We will be, yeah, yes, okay. It seems that a statewide assessment or survey that is led by a university level researcher would be helpful for that, rather than individual programs trying to get feedback in meaningful ways that are scientifically valid. Are there plans for something like that? Danielle, I appreciate this feedback because I didn't think of this, but it's something that we had been, I'm going to copy this. It's something that we had been talking about, like how can we get, you know, kind of like a scientific or an statewide assessment, and this is a good idea. So Danielle, there's no plans for that, but this is a good idea that you just shared. So I appreciate that. Thank you so much. Anyone who reports to Pecan, Nevada, I have all that information. So also we are hoping that everybody reports to Pecan, Nevada, that everybody participates with Pecan, Nevada, because they are to go to agency in terms of data, because that's what they do, that's what they manage. So if working with Pecan is not happening with you, shoot me an email. We can make the connection, talk to Amanda. But if you shoot me an email, I will connect Amanda so that we can get you all the assistance that you have, because the purpose of GMU is to only make CBCAP and CTF way stronger and make sure that we report the great work we do. I know you mentioned that the RFA will be going out soon for state fiscal 21-22, but do you happen to know when that grant application is due? The grant application for the RFA, which is now called NOFO, Notice of Funding Opportunity, because, you know, we can't make it easy. I believe we are shooting for March. That would be our deadline, but it will be soon. So I will for sure make sure that all the sub-grantees that are really currently, that are now currently receiving funding, get that information. And I don't have an exact date, but I know it's coming soon. And you're all going to know. Any other questions? Okay. Sorry, since this is delayed, I should have been clear. The pinwheel for prevention information, I have it from anyone who reports. I was just trying to avoid people having to duplicate efforts. The report is on our website, or it can email it out so sub-grantees can see it if the information is accurate. That's a great clarification. If you do participate with Pecan, you should check their website. They have data regarding the numbers and services, which I'm sure you already know if you work with them. If I want to say some of the things that we are working on is we are revamping our website, and we are revamping our website to show, in my head, it's going to be perfect. So once that website goes live, I'm going to send an email saying, please check our website, make sure that the information that we reported on your agency is correct. I want to list all the programs that are funded under all fundings. So if you're a CBCAP or CTF funding, I have CTF, a description. I'm going to say Happy House agency received funding for parenting classes. Please check their website. So, I'm excited that we are trying to shape our website because I feel like it's not personalized to each program. I'm hoping that that's going to be easy on all of us, and you would be able to find all information on a certain grant on a certain page, and you don't have to navigate through the whole page. So I'm excited about that. I am hoping that it turns out the way I think it's going to turn out. But I'm also going to need your assistance and your feedback when that happens, because then we need to turn around and make sure that I have the correct information in regards to your agency. And it's going to link to your website directly. So, for example, top of my head, Ron Wood, you will see that they were awarded for this funding, and they're providing parenting, and you should be able to just click there and takes you to their website. So we're trying to really, when I said we're trying to be partners in prevention and information, this is one of the steps we're taking to make sure that we can work together. Any other questions? And I look at the camera like you're going to answer there. If no other questions are being posted, I know I talk too fast, guys. I am going to work on my speed. So I appreciate your attendance, and I will make sure that your reports are sent to you by tomorrow, 5 p.m. Okay? Well, there's one more question. 1 second. Oh, no. It says, thank you, Amanda, for the pecan information, and thank you, Yaraset, for putting, oh, you're welcome. You guys have happy holidays. Enjoy, hug your loved ones, and enjoy your time, okay? If you have any questions, shoot me an email. I am here to help you. Thank you.